Welcome to the Lean Blog Podcast. Visit our website at www.leanblog.org. Now, here's your host, Mark Graban.
Hi, this is Mark Graban. Welcome to episode number 78 of the podcast. Today's guest is Sorrel King, the author of the new book, Josie's Story, A Mother's Inspiring Crusade to Make Medical Care Safe. In 2001, Sorrel's 18-month-old daughter, Josie, died tragically after a series of preventable errors at one of the world's top hospitals. In the aftermath, Sorrel channeled her energy not into destroying the hospital, but instead into helping all hospitals learn and make improvements based on what happened to Josie. Sorrel started the Josie King Foundation and has been an influential voice in the healthcare quality and patient safety movement. While today we're not discussing quote-unquote lean per se, I think much of what Sorrel talks about will resonate with lean thinkers, as well as with anyone who has an interest in safer healthcare in terms of what's needed from a systems, communication, and leadership standpoint. So I want to welcome our very special guest today, Sorrel King from the Josie King Foundation. Thanks for taking some time to talk today.
Thank you, Mark. It's good to be here.
So I want to start first, maybe if you can tell us about your new book, Josie's Story, and what you think the lessons are that can be learned from the tragedy that you and your family had suffered through. What are the lessons for healthcare providers about some of the keys to better patient safety?
So the book just got published a few weeks ago, and I wrote the book for a number of reasons. I wrote it for the healthcare industry so that they will always remember the story and remember the importance of communicating, the importance of good teamwork, the importance of listening to the patients, listening to the family, listening to each other. I wrote it for the leadership of hospitals so that they will realize the importance of their staff, their docs and their nurses, saying to them, quality is important, patient safety is important, let's prevent these errors from happening. I wrote it for any parent that's ever lost a child, and wrote it for my children, for my family, so that they'll always remember Josie. But I really wrote it for, and one of the most important threads throughout the book is, I wrote it for any person who's ever suffered from loss or disappointment. We're all going to suffer from loss or disappointment. It might be death, it might be cancer, it might be a divorce, it might be a loss of a job or bankruptcy. But I think the main message in the book is about taking that bad stuff and figuring out a way to make something good come of it. And by doing that, we not only sort of help ourselves, but we can help others. And so that was kind of my purpose in writing the book.
Well, I was going to ask, you talk about channeling what could have been, a lot of anger into something constructive. As you've looked into some of the causes of medical errors, I'm wondering if you can share some of the things that you learned and what you found that was maybe surprising about why incidents, medication errors, preventable errors occur. After
Josie died, I kind of first thing I never really knew was that patients that medical errors are happening. I didn't know 8 years ago that 98,000 people die from medical errors every year. Fourth leading cause of death in the country, like a jumbo jet crashing every day. I didn't know that. And that was another reason I wrote the book, was to raise awareness within the general public. And the book, the main message, the main sort of patient safety message in the book and sort of in the work that I do at the foundation is the communication piece and the culture piece. We all know that the Joint Commission states that over 70% of all sentinel events are due to a breakdown in communication. So that's my message as a mother and as a patient safety advocate. Josie died because people didn't communicate. And that's the problem with a lot of these medical errors. It's not one doctor or one nurse or one misplaced decimal point. It's the system, the breakdown in the system, the breakdown in communication. So that's really kind of my message in the book. Change the culture. Leadership needs to speak up, encourage their employees to do something about this.
Now, I know you speak to a lot of hospitals. You've spoken to groups like the Institute for Healthcare Improvement. What is the reaction or reactions that you get from medical providers, physicians, hospital leaders when you hear their message? How do they respond in terms of what they think they can do or what's actually possible?
They wherever I go, I mean, these speaking requests, I don't go out looking for them. They just keep coming in, which it seems crazy to me. But everyone is very receptive in improving this culture. It seems like wherever I go, I mean, you know, I'm always at these big conferences, patient safety conferences, and there's people are talking a lot about it, and there's PowerPoint presentations, and there's a lot of data and a lot of statistics being thrown around out there, and that's all really great. But I think what the healthcare industry, I think what people are hungry for, and what I've learned over the 7 years or so that I've been doing this, is the power of a story. And the power of this story, it just seems to be resonating with the healthcare industry and medical schools and nursing schools and law schools are using the story. The aviation industry is using the story. So I think the story is having a huge impact on people out there, and like I said, it's changing the culture. It's helping people, communicate better.
And that's probably surprising to people, where they must assume that a lot of it might be a technological problem, and people say, well, we just need some new fancy technology, information systems, barcoding. But it is pretty amazing that it comes down to these very human dynamics. So maybe on the one hand, things like that are easier to fix, but maybe on the same time, if it was easy to fix, people would have a better culture in place already. What kind of thoughts have people shared with you about the difficulty, the gap between understanding that we need to improve the culture and what people are actually what they're able to do to make real change in their culture to improve safety?
Right. I think it's kind of a gray area. I think it's a really hard thing. I want to go back a second. You kind of got me thinking when you were talking about technology and barcoding and all of that, which is all really, really great. But I think if we do that without changing the culture, then I don't think it will be as effective. But if we can change the culture along with doing that, then I think we'll really be on the right track. I think changing a culture, from what I've learned and from what people tell me, sometimes people say, Sorrel, you're like a dog running up a hill with a rope in its mouth pulling a locomotive. People say that changing a culture is like the hardest thing to do, I guess. But I think it's happening. I think there are a lot of people that are out there doing some really great patient safety work. And I think it's hard for the healthcare industry because it is hard to measure. I mean, how do you measure potential lives saved? Or, it's kind of fuzzy and kind of gray and kind of seems vague sometimes. But that's. I just try to get the message out there. I try to inspire caregivers to think about it and why we're doing what we're doing. Why are we having this new technology? Because we've got to change the culture. It's all, to me, it just seems all sort of interrelated.
Yeah, and you talked about the fuzziness of the numbers. People often ask, this 98,000 number, where does it come from? I think part of the problem is that nobody really knows for certain if it's 75,000 or 125,000, or there's different studies. It's all based on somebody's best determination and then extrapolating across the whole population. But I think you're right. Regardless of the exact number, each of these preventable errors and cases of patient harm or even patient death is one tragedy too many, and it doesn't get the attention that it would get. To the analogy that you drew about a plane crashing every day, that unless it's a story like the one that you tell, statistics can be hard to translate into something to get the general public aware of, or to get the healthcare providers and probably more importantly the hospital leaders engaged around to improve culture. So I think that's seems like one of the challenges.
It's the whole awareness thing. It still blows my mind, and I think about it like you and I. We know what Mothers Against Drunk Driving does. We know what MAD is all about. I mean, we all know it. What a great organization that is. We know about that organization because we're going to get in a car this afternoon and we're going to hope we don't get hit by a drunk driver. And we all know about drunk driving. We all know about these car accidents. I think more people die from medical errors than do die from drunk driving. It blows my mind that the general public still doesn't quite get it. Mark, my book, a couple months ago, my publisher called me up and said, "Hey, Sorrel, Good Housekeeping is going to do, wants to feature your book in the October issue." That's right now, this October. And I remember saying to her, "Well, gosh, I was really hoping for Vogue. I really would. My 13-year-old would think I was so cool if I was in Vogue." But the publisher said, Good Housekeeping, 13 million people, circulation of 13 million. Vogue is 2 million. Good Housekeeping is the heartland of America. So, through this book, which to me this book is just another tool, a foundation tool, another tool in my toolbox. But this book, it's in Good Housekeeping, and the woman, a mother in Des Moines, Iowa, is in a doctor's office, and she's probably looking at Good Housekeeping, and she's reading about medical errors and how to prevent them, and what patients and families can do, and what healthcare providers do. And so, and hopefully in my small way, this book is raising awareness. I mean, there's so many other great books out there. Jerome Groopman, Atul Gawande, Bob Walker, great books. But unfortunately, I don't think that some people in the general public might not pick those books up because it's not something on the top of their head. But hopefully Josie's story, mothers and people can kind of relate to it because it's a mother who's writing a book,
Mm-hmm. And in the book, do you give direct advice to a parent or anyone who has a loved one going to the hospital of what precautions or steps that they should take in pretty concrete ways to help make sure that the environment they're in is a good one, or that errors are less likely to occur? What can people do?
Right, absolutely. The book in the back of the book, there's a resource guide, which I was really psyched about. The resource guide is split up into two sections. One section is for patients and for families. The other section is for healthcare providers, and it's pretty much sort of steps on how to manage for the patients and families, how to manage your stay when you're in the hospital, what you do. When something goes wrong, what do you do? How do you get medical records? If you have to get a lawyer, how do you hire a lawyer? How do you go about it? What do you do? And then for the healthcare providers, it's just programs and things that they can do to communicate better and change their culture within their organization. But the whole book, the whole book is about sort of that. You know what I'm saying? And so if a patient reads the book, and they don't read the resource guide, they're definitely going to come away with, wow, when I go to the hospital, I've got to pay attention. Wow, I can't ever be afraid to speak up. I should try to have an advocate person with me. I should write down, I should document stuff. I should keep track of information. So that's kind of all throughout the whole book. And then it's the same thing for the healthcare provider. There's a whole bit about the importance of leadership, doing what they need to do, and the importance of what nurses can do and doctors can do, and rapid response teams and family-activated rapid response teams, and transparency and disclosure, the importance of all of that. So all of those threads are throughout the book, but it's all sort of tied up into a nice little package in the resource guide.
Well, that's good. It's good to hear that there's something people can take away from the book, because we're all going to end up, it's very likely when we have a loved one in the hospital this year, and it's very important. I'm glad that you're sharing that for people, for their loved ones. One final thing to talk about here, you channeled a lot of your energy after Josie's death into the foundation, the Josie King Foundation. I was wondering if you could tell the listeners a little bit about some of the main activities and things that you're able to accomplish through the foundation.
Right. So the foundation really kind of just stems from a settlement. Hopkins offered us money for the death of our daughter. And like this is all in the book, we didn't want the money. By taking the money, we'd be letting them off the hook, blah, blah, blah. But long story short, we took the money and we decided we'd do something for Josie. We'd do something good with it. And we created the Josie King Foundation. Our mission is to prevent patients from being harmed or killed by medical errors, a simple mission. And we've got lots of, different programs kind of going on. Money comes in from donors and sponsors and from people, healthcare industry people who purchase the DVD, and then the money goes really back out into the healthcare industry. We've done a lot of family-activated rapid response team projects. We've done a care journal project for patients and families, a little journal for them to take to the hospital so that they can keep track of information and sort of steps on how to manage your stay. Our latest project, which I'm really excited about, is called the Nursing Journal, and this is also in the book. A few years ago, we kind of realized that, it's not just the patients and the families that suffer from an adverse event. It's, the doctors and the nurses really, really, really suffer too. And this is a program really just we were going to start with nurses first. There's a nursing shortage. Nurses are stressed out. They're being pulled in a million different directions. And I think they've got a really tough job, and I admire them so much. So we gave some money for some research to be done on the therapeutic benefits of expressive writing. And long story short, as I was working on this project, I was kind of struggling with it. I said, God, something's not right. And then I said, oh, my gosh, I'm not a nurse. How am I who am I to tell nurses what's good for them? So we sent out an email to nurses all over the country saying, hey, send us your tips on what you do to deal with the stress of being a nurse. And it was so cool because we got tips from nurses all over the country on how they deal with it. And that's part of the Nursing Journal workbook. So it's great. That program is really just 2 weeks old. And as I travel around the country talking about the foundation and talking about the book, I get to talk about the Nursing Journal and all these other projects. And it's gotten really great response so far from the nurses out there. And I'm really excited about it. But our main goal, the main focus of the foundation is, like I said earlier, the communication and the culture piece. And that's what we do. I do a lot of public speaking. I meet with medical students and nursing students and residents and law students. And we've got a disclosure program. We've created a disclosure program to help hospitals, figure so to explain to them the importance of transparency and how to talk to a family after there's been an adverse event. And lots of other things, but those are pretty much the top few on my list right now.
Well, it's great work, and I'm glad that you're doing it. The DVD that you mentioned, I would recommend, especially to listeners who are with a healthcare organization, that your organization can buy that DVD, josieking.org. It's a very powerful DVD of Sorrel giving his speech, talking about Josie's story, and hopefully it's something that people will purchase to help not only spread the message of improving patient safety, but to also help fund the good works going there at your foundation. So, Sorrel, it's certainly an honor to have you with us today. I want to thank you for your time, and do you have any final thoughts to wrap up for the audience? Anything else you'd like to share?
I read Josie's story. If you're in the healthcare industry, it's great because doctors are coming up and they're saying, oh, we got to buy these for our residents. Oh, our medical students need these. Oh, we got to get these to our board members. Oh, hey, can you write a dedication to my CEO? Or, hey, our patient safety officers need to read this book. So it's having the effect that I wanted it to have on people. I think it's helping change the culture. It's helping inspire people to continue their really, really great work out there. And I think people are saying it's a good read. They like it. They read it. It's done in a couple of hours. It's not a real thick, long book. But I just appreciate all that people are doing out there. I think really great things are happening, and we're on the right path, and it's all good. And thank you for having me, Mark.
Well, certainly. And thank you, Sorrel. Sorrel King from the Josie King Foundation. It's great talking to you today.
Thank you.
Thanks for listening. This has been the Lean Blog Podcast. For Lean news and commentary updated daily, visit www.leanblog.org. If you have any questions or comments about this podcast, email Mark at leanpodcast@gmail.com.